Nevada's Opioid and AB 474 by Kayla Walker. What was the healthcare or public health problem the bill or bill chain was attempting to address? The healthcare or public health problem AB 474, the Controlled Substance Abuse Prevention Act, attempts to address the extremely high numbers of opioid-related deaths in Nevada. Because of this, the Nevada state government got involved. They did not interfere with the delivery or specific medication for patients. What policy or policies are attempting to address this problem? The policy or policies Nevada lawmakers are attempting to address involves the protocols and procedures written opioid prescriptions that were deemed related to the opioid epidemic in Nevada. Hence, Nevada wanted to do something state-specific because the opioid epidemic is the deadliest drug crisis in American history. Johnson, 2019. At what level were these policies implemented, i.e., federal, state, local? Healthcare organizations have an opportunity to collaborate with authorities who implement the law, as state and federal authorities have suggested, to hold pharmaceutical distributors accountable, and the lawmakers brought by state attorneys general say despite signing consent decrees and paying fines, the companies have continued to ship thousands of doses of opioids to troubled pharmacies. Rosbaum, 2019. Thinking from the viewpoint of a healthcare administrator, what are the potential pros and cons of this policy? Are there any potential negative ramifications of this bill? Pros. First and foremost, there should be a significant reduction in the number of opioid-related deaths. Physicians should have more manageable time to properly see their patients. Thus, patients should be more receptive to their physician's medical advice for opioid alternatives. Overall, physicians should expect themselves to have accountability increase because of things like technology being streamlined as an aid to reduce duplication and redundancy, thus increasing the time management and the integrity of data accuracy in patient paperwork. Cons. On the other hand, the cons are unfortunate for the state of Nevada's physicians and patients. First, there is a shortage of physicians, both medical and alternative medicine. Next, there is a physician shortage in Nevada. Then, money is an issue. Physicians are seeking their medical reimbursements for the time they deal with their patients. Unfortunately, it is reported that one of the things that happens with low reimbursement rates in physicians in primary care tend to see more patients per hour than they easily accommodate. Silverstein, 2018. For what stakeholders will or are affected, i.e., healthcare providers, patients, insurance companies, etc. The stakeholders, i.e., healthcare providers, patients, insurance, etc., that will be or are affected by this opioid epidemic, and AB 474 varies. Healthcare providers are being formally advised that mounting evidence suggests that opioids may be associated with important harms, including overdose, abuse, addiction, and diversion. PCORI 2019. If you are in the future or currently working in a healthcare organization, how do you think this issue will affect your organization? As a future administrator in a healthcare organization, I think this opioid issue and the AB 474 will affect the organization in many ways. Healthcare organizations should find strength in obtaining options from other sources. Resources. Thank you so much for watching my video.